Welcome back, viewers, to Faith and Discipline podcast. Our topic today is brain stroke, and our guest is Dr. Asghar Bhayo. He is stroke consultant in one of the NHS trusts. Welcome to our show, Dr. Asghar Bhayo.
Thank you very much for inviting me.
Right, so let's begin. Our first question is, what is brain stroke and what are the symptoms?
Brain strokes are two types. To start with, any damage to the brain because of problems with the blood supply is called stroke. So either it could be clot, which is blockage in the blood supply to the brain, or it could be a bleed on the brain. 85% of the strokes are due to a blockage, which is clot, and around 15% is because of hemorrhage in the brain. Hemorrhage can be because of different reasons. Could be the reason is primary or secondary, but mostly it is the blockage which we are concerned about.
Some people link body paralysis with brain stroke. Is it always the case? The body paralysis is due to brain stroke?
I would say yes, most of the times, but not always. So what we say is paralysis is a symptom, means you cannot move a certain part of the body. It could be one side of the body, right or left. It could be the lower part of the body or just one limb like an arm or a leg. Similarly, paralysis can be because of the, you can have a facial paralysis also. But stroke is different from paralysis in that stroke reason is because of loss of blood supply or bleed. Paralysis can be due to other reasons also. For example, if somebody has got a brain tumor affecting a certain part of the brain, they can have paralysis also. Similarly, because our nervous system consists of the brain, the spinal cord and the nerves. Any problem in the supply or signals from the brain to the part of the limb can cause paralysis. For example, facial palsy or Bell's palsy, again the problem is in the nerves, not in the brain itself. Similarly, if somebody has got a spinal cord injury because of a tumor or a fracture, or they can have paralysis also, which is not due to stroke. So difference is the etiology, what we call is the reason, rather than the symptom may be same, but etiology is different, and obviously treatment is different also.
I want to push a little bit more because not everybody is aware of the real symptoms. So if we want to make people aware of the symptoms, like what symptoms people need to look for to spot the stroke?
I think it's very important, as it's a very good question to understand. For example, when you ask the first question about paralysis and stroke, so paralysis, if due to other reasons other than stroke, may be gradual or slow onset, or a certain trauma has happened to the brain or the brain cord. But in stroke, it can be sudden onset. For example, somebody might be just walking or may wake up with symptoms of what we call is a stroke or paralysis, because the brain supply is damaged. The blood supply to the brain is damaged. As I said, could be because of a clot or a bleed. So if somebody cannot move one side of the body or one limb, then it's a high chance that they are suffering from a stroke, which is what we normally call is a cerebral vascular accident rather than the paralysis. Yes, the outcome is paralysis, but it's a stroke which has caused it. So obviously the early detection helps to improve the symptoms as well as through and right management.
Okay. You know, there's a medical terminology called CVA and TIA. What is the difference?
CVA means cerebral vascular accident, where the damage to the brain is more or less permanent, and because of that the paralysis or not moving any limb will be more longer or permanent. But TIA means transient ischemic attack, means transient is a short-lived, so you may have kind of a weakness for a short time, ideally less than 1 hour or so, and then you resolve completely. TIA should be taken as a warning shot that they should be investigated very extensively, because the next time they may have a stroke. So kind of a warning shot for people.
The reasons for TIA and CVA are the same, or is there any difference?
Yes, more or less. Only difference is TIA will never happen in bleeds.
Okay.
Yeah, because as you can imagine, the bleed does not go away quickly. If somebody has got a bleed, they will have a permanent damage. They will be more classified as stroke. TIA mostly is because of blood clot.
Okay. So if someone has persistent episodes of TIA, what are the chances they will get CVA?
Studies suggest if somebody has got one TIA, for example, they should be thoroughly examined as well as investigated within 7 days. They should be ideally seen within 24 hours by a specialist. That what normally HNS runs like this. They have a TIA service throughout the country. The highest chance is in the first 28 days, and the highest chance again is in the first 7 days. So they need to be investigated fully as soon as possible.
So talk about this country, how big this problem problem is?
I would rather say stroke in itself, as I said, has to be identified and treated early. Otherwise, the consequences is quite huge. The bill to NHS system is around £8 billion. As you can imagine, it's a big burden on the community, because somebody you can imagine who is maybe in their 50s, 60s or 70s, independent person, suddenly suffers from a stroke, so their life is changed completely. So from an independent person who was going out driving has become bedbound in the house, so they will need all this. So that's why it's a big burden to the community as well as to the NHS.
£8 billion, that's a hefty amount of money to taxpayers. That's the damage to the economy. How it damages to the body, how serious it can be?
So depends on the type of the strokes. So as I said, there is the clot one, which is the blockage, and the bleed one. The blockage one, if you have a big stroke, what we call is total anterior circulation stroke, the mortality is around 60 to 80%. So within 28 days, around 60 to 80% might have died. So it's a big impact on their life also. Okay. Similarly with the bleed, depends on where the area of bleed is. If it's a big bleed, mostly they are, unfortunately they die within a week or so.
Okay, so that's quite unfortunate. If we look at statistically, gender-wise, is it mainly male patients who become victim of stroke, or is it female?
If I'm honest, yes, female gender is an additional risk factor, what we call is atrial fibrillation, which is an irregular heart rate, and it can cause, and then if you are a female, if you have atrial fibrillation, you have a higher risk of having a clot, and then obviously higher risk of having a stroke.
So stroke can happen to anyone, any gender or age. So in older adults, what are the main reasons?
It's a accumulation of different diseases throughout the years. So risk factors for having a stroke is just like anybody who's having a heart attack is diabetes, high blood pressure, smoking, high alcohol intake and everything. These are one of the reasons of having, and again, in advancing age, and with advancing age comes atrial fibrillation and other disease processes.
What is the main reason the stroke might happen in the younger people?
For younger people, we might have to dissect this into two big groups. One is the Caucasian group, which is the white people, and then the Asian group. Unfortunately, Asian peoples have got different risk factors, especially we develop diabetes and high blood pressure at an early age, and because of this we may suffer a stroke less than 50, but white or Caucasian people don't have this risk factor. Their risk factors for Asian population, if you compare it, will be above 60. So rarely they will have a stroke less than 50. But again, there is a full cohort of disease processes which can cause young strokes. This can be because of problems with the vessels, problem with the clotting factors, problem with the bleeding factors. So there are other reasons also. Similarly, there are heart conditions also which may predispose people to stroke.
In younger population, what are the signs we need to look for to prevent them from stroke? Is it something to do with congenital?
Very rarely, yes, but again these are picked up by the heart doctors mostly. For example, what I'm trying to say here is stroke comes a bit later. They will have other problems picked up earlier than the stroke, but rarely people can have it. But as I said, it's mostly but again it's difficult. It's a small population or a small group of people may have it, rarely, but again it does runs in the family also. So we might have to be looking at any risk factors which runs in the early stroke in the family. Older
adults, does the signs come up really quickly, or they start to develop over time? We need to be aware of.
So if you will see, when we say stroke, means what? Sudden onset something. You have stroked means something has changed. So it's a very sudden onset. So that's why it has to be picked up. The TIA, as I said, is a precursor. So if you have a kind of a warning shot, you'll be more eligible to have a stroke. But it can happen without any warning sign also. It's a very sudden onset. Then you have to think of it's kind of a blood supply problem.
So if someone is suffering from irregular heartbeat, AF as mentioned, so do they need to see the cardiologist as soon as possible?
10% of people population in UK are undiagnosed with AF. So they may develop, so they need to go on medications. This is a study done about 8 to 10 years ago, regional study. We did a paper also and present UK Stroke Forum also, that 10% population are missing. Reason being the same, that they may have atrial fibrillation, they don't go and seek advice because they need to go on certain medications to thin the blood, because that's the only protection they have, which is almost 80 to 90% protection. So this, which is very good, but it's difficult to pick up them. So these people have to be targeted more.
Okay. So, stroke can happen to any part of the brain. Usually if we divide left and right, which side of the brain stroke is worse for the body?
Well, if you look at what does the stroke do to you? The stroke, it takes away the ability to function properly. For example, you will have weakness, or you may have difficulty seeing. So what mainly is affecting is your speech and other things also, like you're losing your function. So around 60 to 70% population are right-handed. The brain works the other way around. The right side of the body is controlled by the left side of the brain, and vice versa. So you can say maybe the left side of the brain is more dangerous because it will affect your, not only your writing, because you're right-handed, so you can't do things properly. Similarly, your speech is affected also, you can't say things properly. So it does affect. So I think if you look at the cohort, its left side brain stroke might be more worse than the right one.
Let's talk about the treatment. If someone had a stroke, what treatment options are available?
Fast means if you have a problem with your face which is drooping, or your arm is not working, means paralyzed, or your speech is affected, time is important. So every minute time means brain. Every second you're losing cells in the brain. So the more time you leave, the more damage you may have. Why I'm saying this is because if somebody, imagine, had a stroke in the morning at 9, if they don't seek medical advice soon enough, they may not be able to have the CT scan on time. If they don't have a CT scan or any imaging of the brain, then they will not be able to give appropriate treatment. Though 85% of strokes, as I said, are because of a clot. There are clot busting medications, but there's a time limit to it. They need to be given within 4 hours. The earlier we give the clot busting medication, the better outcome will be. The later we give, the worse outcome may be. Obviously, there's a 15% of people who may have bleed on the brain. Again, in that cases, the blood pressure control is very, very important. The earlier we have good blood pressure control, the less damage will be brain to. So time is brain here.
Okay. Another disease is called aneurysm. So if someone has aneurysm and that busted and there's a bleed in the brain, how that's treated?
It's treated on two lines. One, obviously, just like a bleed, because initially when they come, if they're known to have aneurysm, then everybody will know they've got an aneurysm, will bleed. If they're known not to have this, the first time they're bleeding in the brain, so what will happen might be is when they come in, first need to control the blood pressure, and then they will need certain images, of the brain to confirm that it's an aneurysm or not. Once the aneurysm are confirmed, they're referred to either the neurosurgeons or the interventional radiologist. They put stents there to block or close these aneurysms.
Right. So as you mentioned, delay in treatment can cause complications. What the worst can happen if the patient is not being treated within 4 hours?
So again, imaging is very important. So let's say, for example, somebody had symptoms at 9 o'clock in the morning, and then they called the emergency services, and they are, as you know, that the fast service is there. They bring them within 15-20 minutes, half an hour is the response time, at the max 1 hour. That's what normally happens. So they will be in the hospital by that time. So immediately a red alert is given to the hospital's emergency services, the emergency department. As soon as they hit emergency department, they're taken to the scanner. Once the scan is done, if it's a bleed, obviously blood pressure control will be managed, and they'll be referred to the neurosurgeons. If there is a clot or there is no bleed on the brain, then they will be given the clot busting medication. The earlier it is given, if there's no contraindication, the better outcome it is. So yes, recognizing it and alerting the system, and then coming to the hospital, getting the imaging, earlier the better.
So are we saying if there is a delay, it will damage the brain cells forever?
So what we are trying to say here is, for example, again, if you look at the same example, 9 o'clock they had the symptom, and then they cross 4.5 hours of time, which is a normal clot busting medication given time, then they will not benefit from it. They won't be offered. Reason being, the delay it is, the risk of bleeding will be more with the clot busting medication. As you can imagine, it's a clot busting medication. It may have damage to the brain vessels because they are very thin and friable. At the same time, they're going through a change because the stroke has happened, so they'll be more prone to bleeding, so they won't be offered. So that's why they miss out.
Okay. So are there any complications patient might suffer post procedure?
Oh, yes, there is. So as a clot busting medication, the biggest risk is bleeding, which can happen anywhere, but mostly can happen on the brain also. That is the biggest problem. If you correctly choose the patient and the right timing, as I said earlier, you will have less complications. Later you have more complications. So bleeding is the biggest problem. Apart from this, unfortunately, many people may decompensate either ways, despite you giving the treatment also. And the biggest killer is pneumonia, which is aspiration, because they lose their swallow most of the time. Then they don't do well, unfortunately. Another treatment which also is being widely used and then they have to be chosen is thrombectomy, which is getting the clot out of there without giving them treatment, which is very good, but it only can be given to certain type of strokes, because you need to have a large vessel occlusion, then only can be given. It can't be offered to everybody.
How do we manage stroke patients in this country? What support is given?
So obviously after the first initial management, they are taken to the stroke unit. If I say a stroke doctor job is up to 4 hours or 4.5 hours, reason being because that's a time decision you need to make for clot busting medication, or once that is passed by, then the main stay comes from the therapist. So they are the one which look after them, they look at them closely. Obviously the doctor team is there to look at any medical complications, but depending on the severity of the stroke, they depend and they make guidelines for them, they make exercise programs for them, and many of the people may go onto a stroke rehab unit where they continue to improve. Now I'm going to give you a very bad example, but this will give you an idea how the stroke works and how it works. So for example, if you consider there are 10 people in a room and there is a bit of a blast there, the initial impression will be 10 people are dead. But as the time passes by, actually not 10 are dead, actually 2 are dead and 8 are alive. Out of these 8, 2 might be very severely injured, may not recover completely, but 6 are less severely. Out of these 6, 2 are a bit more, but they can get better, and 4 actually didn't had any much injuries. Same like stroke, initial impression is everything is dead, but as the time passes by, brain has this ability to recover, and that's why they have these extensive programs, then they recover nicely. So we have seen many times they come with complete paralysis and have walked out of the hospital.
That's very good news. Right, so what is your recommendation how we can prevent stroke?
So I think to start with, it's a general recommendation to start with. Number 1 is healthy diet. Look after yourself, control your blood pressure, control your diabetes, stop smoking if you can. Any healthy habits need to, that's number 1. Number 2, if you develop symptoms, you need to seek medical advice as soon as possible so that we can initiate the treatment as soon as possible, and depending on the type of stroke, that further management can be done. Obviously blood pressure control, and then taking your medications, again looking for other risk factors, for example cholesterol, atrial fibrillation, any other young stroke screens or heart problems that need to be addressed accordingly.
What is the major contributor, shall we say? Is it the lifestyle or is it the diet that can cause?
If you want to control, one big thing is diabetes and hypertension. Yeah, they are the most common reasons of having a stroke in elderly people, because it does take a bit of time. So like just diabetes and hypertension slowly damages your vessel. As they're damaging your vessels outside the brain, they're damaging the vessels in the brain also, and people come with strokes.
Thank you very much. It's been very useful conversation, Dr. Asghar Bhayo. I'm going to ask a question. You might find it funny, it might be controversial, but because our viewers, they are from different communities, different backgrounds. So there are people out there, they talk about other type of treatment, which is not conventional treatment. And I've heard, like, pigeon as a bird. So eating the pigeon's meat can help with stroke recovery. Is there some evidence there?
I don't think there's a direct evidence there, because I don't think there's any studies done to prove that. But what I can tell you is stroke is not a new disease. It has been in the communities for centuries and centuries and centuries. I think the first stroke might have been around 3,000 or 4,000 years ago. Can you imagine? We are talking about 3,000 or 4,000 years ago, first time it was mentioned. Again, at that time we didn't have any imaging, so you can imagine again the same thing comes is when the damage is brain to the done, it only needs time to recover. So that's what's happening. So yes, you're giving something to improve their health, to improve their diet, which is the body itself is taking time to recover. I think that's what's happening.
So shall we say it's more placebo than the real?
I agree with that. Yes. So yeah. Maybe what we'll do a randomized controlled trial to see if it happens or not.
Very good. Right. Thank you very much for joining us today. It's been really useful, and I believe our viewers have found it very useful as well.
Thank you very much for inviting me. It's a really good thing. Thanks very much.
Many thanks, viewers, for watching this episode. If you found this useful, you can subscribe to our channel, and you can share with your family and friends. We intend to do our podcast live in future, and we will take your questions and try to help you as much as we can. Thanks for watching.